Hi, my name is Mike Beyerschmidt. I'm a patient of Dr. Matthew Kaufman, and I had a phrenic nerve transplant surgery. I had it 9 years ago this month. It started after a rotator cuff surgery on my right shoulder. I had the nerve blocks injection, and then when I woke up, I felt not right. I couldn't catch my breath. I felt like I was having panic attacks, and then I just kind of lived with that for a number of months, and then had trouble breathing, and then finally, eventually went in the hospital for pneumonia because the lung wasn't working right. And then eventually I went to a pulmonologist. Pulmonologist says, you need a sniff test. Go get the sniff test. And I find out I have a paralyzed diaphragm. So then the research goes in. My daughter's a naturopath doctor in the West Coast. And we both found through the internet, Dr. Kaufman, and the information about the phrenic nerve surgery. I then called the office, and the staff was very nice. It got me in touch with Dr. Kaufman. We had a phone interview because I live in Las Vegas and I was on the West Coast. Asked me a lot of questions. I guess I was a suitable candidate for the surgery because 9 years ago it wasn't as used as much as it is now. So I was kind of one of the first 100 or so people that had the surgery. I came into the office, loved the staff, they were very kind, understood what I was going through. Dr. Kaufman told me the whole procedures, was very self-assured in that he knew what he was doing, which I'm glad he did know that. But I felt very calm, just very calm that it was going to work out. Prior to that, I was very nervous. I thought my life was basically over to the extent of doing the things that I like to do. I like to ride bikes, I hike, I play golf. Pre-op was very, I can't say it's easy, but very informative, a lot of communication between the staff and me, letting me know exactly what to do and how to do it and where to be. The surgery basically was very easy. You show up, Dr. Kaufman comes in, it's very easy, he reassures you. I felt very comfortable about it because one, if it worked, it was going to change my life. And I was willing to take that risk. So when I woke up from surgery, a surprise was it worked immediately. I was a very lucky person that when I woke up I could tell the difference that I was breathing at that time. I was breathing better. I can't say normal, but I was breathing better. And then the post-op with the staff and everybody communicating, Dr. Kaufman following up, and then going back to my hometown, Las Vegas, then I have to educate the people that I'm talking to about what happened to me, what I needed from them. And finding the right physical therapist that will work on your muscles versus thinking that it's a lung problem, that can be something that can be a challenge. But Dr. Kaufman came in when we were doing this interview. We met and we talked about it, and I asked him some questions about that. And he mentioned that part has been much more streamlined. There's a lot better information. They're helping you find the right physical therapist and giving you insights on what you need to do to find that physical therapist to help you on the post-op, which is very important. And you have to work at it. You have to exercise, you have to do what you need to do. And after 9 years, I'm playing golf at least once or twice a week. I exercise regularly. I ride my bikes from 35 to 100 miles a week. I hike Zion. I played Pebble Beach the other day, so life is good at this point. If by chance you see this video when you're searching for help on a phrenic nerve paralysis and listening to this and you say, hey, this may be for me, I would suggest that you definitely try it. Being in that situation where it's difficult to breathe, you're not feeling well, you're coughing, you're wheezing, and getting into this situation where you have an opportunity to change your life and to do something that will make it better, I would definitely take this opportunity to work with Dr. Kaufman and his team, which has been outstanding.